Well, hello, and welcome to another session of AFTA's Fresh Take Friday webinar series. I'm your host, Carrie Rigdon, and today we will learn what EHS-Net data can tell us about food safety culture in restaurants. We've got an excellent speaker here with us today, but first, a little housekeeping. First, please note that this session is being recorded for future viewing, and we ask if you have any questions for our speaker, please leave them in the Q&A box. You'll see that down below. And we will make sure to address those during the question and answer portion of our session. We ask that you use the Q&A tool instead of the chat. That just makes it easier for us to see the questions. And if you'd like to ask your questions verbally during the Q&A, please use that raise hand feature also down at the bottom of your Zoom screen, and we'll prompt you to unmute. Lastly, I'd like to remind participants that the views and opinions expressed during this virtual event are those of the presenter and not necessarily of the Association of Food and Drug Officials, or AFDO. Participation in this virtual event does not necessarily constitute an endorsement of the speaker's views, products, or services. This virtual event cannot be used to train AI models. Now it's my pleasure to introduce our speaker. Dr. Adam Kramer is an officer in the U.S. Public Health Service and currently assigned as a senior environmental health scientist with the U.S. Centers for Disease Control and Prevention's Division of Foodborne, Waterborne, and Environmental Diseases. He works prominently with the National Environmental Assessment Reporting System, or NEARS, and the Environmental Health Specialist Network, or EHS-Net. Adam has worked over 25 years and has experience at the local and federal levels doing food safety work. Now I'd like to turn it over to Adam.
All right, thanks, Carrie. As Carrie said, I am with right now with CDC's National Center for Emerging Zoonotic Infectious Diseases. I have previously been with the National Center for Environmental Health, but you may have heard about a little organizational turmoil earlier this year, which has me now in a new center, but we're still working really closely with our colleagues in National Center for Environmental Health. In the EHS-Net program, and the research I'm talking about is managed out of that Center for Environmental Health. So with that, I want to start telling you a little bit about the Environmental Health Specialist Network, or EHS-Net for short. EHS-Net's really a National Center for Environmental Health funded and managed collaborative program between CDC, FDA, USDA, and 8 state and local health departments. The map shown here shows the sites where the data was collected for the study. It's not necessarily the current EHS-Net participants, but when we did the study, those were the current participants at that time. And EHS-Net really has a goal of describing the prevalence of food safety practices and identifying potential interventions really to improve those practices. And we do this by collecting data through observations and interviews in restaurants. And findings from these studies in the past have really been used to help inform national policies. For example, our data on the positive effects of certified kitchen managers has really helped to inform the FDA food code revisions. So, we have in the title food safety culture, but what is it? And really the study of food safety culture really has its origins in organizational culture and safety culture. And I've presented here 3 kind of the published current definitions for food safety culture. As you can see, this is really still an emerging field, even though it's been around for a bit of time. We go back to Frankie in 2008 with the first definition. It's still a bit emerging and it's still evolving. But when we look at these definitions, we really do see some common elements start to come up, and really that it's shared beliefs impacting behaviors. And it's kind of thinking about those things is going to really help focus your thoughts about food safety culture. So, when we started the study, most researchers, had really focused on examining employee perceptions, their beliefs, their attitudes towards food safety, with the reasoning that behaviors follow attitudes. And the researchers used Likert type questions. These are questions where they make a statement and ask the respondent to indicate on a scale how strongly they agree or disagree with the statement. I think we've all seen these questions, like on a scale of 1 to 5, or, strongly agree to strongly disagree. Where do you fall. Those are Likert type questions. And from these surveys, different researchers have found the responses group into common clusters to help explain common constructs or idea. And you're going to hear me use the term construct. This is an idea that cannot be directly measured. An example is intelligence. We cannot weigh it or measure it directly. Instead, we can measure some attributes of it to derive a level of intelligence. And researchers have done something really similar with the responses to the questions to help describe an idea. And this slide shows the constructs identified by different researchers. And looking at these findings, we can see that management plays a consistent role along with an individual's commitment in having the necessary resources. And we find that there are some differences in what different researchers are finding with the different studies that they have done, which is not at all a surprise. So let's look at what ESNet did. We randomly selected restaurants in each of our 8 ESNet sites and asked them to voluntarily participate in the study. In each restaurant, we interviewed a manager about existing food safety practices and policies. We surveyed workers about their beliefs around food safety in that restaurant, and we observed food safety practices that were occurring. And similar to previous researchers, we surveyed food workers to understand their perceptions of the food safety culture in their restaurant. In most restaurants, we had 1 to 2 food workers complete the survey. However, in some restaurants, no workers completed the survey. And one restaurant, we had 15 workers complete the survey. So for this presentation, when I'm referring to food safety culture, I want to stress that I'm referring to the workers' perceptions of food safety culture in their restaurants. And that's where, some of that terminology can really kind of be a little misleading depending on what we're talking about. So this is how does a worker perceive the food safety there? So, I've provided here a sample of the questions that we asked food workers to rate. And we asked them to rate these statements again on a 5-point Likert scale from strongly disagree to strongly agree, with higher numbers representing stronger agreement. So the higher a score, the stronger it would be towards their food safety culture. And you may notice that we have negative practice questions, like that last bullet that we have here. And these were included to make sure that someone wasn't just going through the sheet and marking the same answer. Hey, I'm just going to mark 5 to get this done with. Uh, and for these questions, the scoring was reversed. So a higher score was a level of disagreement. When we looked at the overall patterns of responses, though, we did see a good distribution of patterns, really suggesting that workers were reading and answering the questions that we were asking, which made me a little more confident in the results that we were getting. So when we started this study, we designed it with a conceptual model based on previous research. I showed those previous constructs, what people had found, and we wanted to build off of that research. However, when we applied our data to those models, we had a really poor fit, indicating our data did not support those models. So we then conducted exploratory factor analysis to identify what constructs our data was identifying. And then we conducted structural equation modeling, really to see how those constructs are interrelated and if there were any higher order constructs. So what we identified, if they helped to show something higher up. So our exploratory factor analysis, we identified 4 constructs: leadership, employee commitment, management commitment, and resources. And it does this by looking at the responses to each of those questions and then grouping similar questions together. In this way, with each of the questions, we are assessing an attribute for each of these constructs, and similar questions are grouped together. So we looked at those, we then examined those questions that were grouped together really to decide on what was being assessed by those questions to arrive at what these constructs were. And I should also add that, when we were doing the analysis, we had randomly split our survey responses in half and built our model with one half of the responses and then tested it with the other half, really to make sure we had not overfit the model and that would have a little bit more general applicability for what was going on. So I mentioned we identified our 4 primary constructs: leadership, which really contains items such as providing training or recognizing employees for following food safety rules; management commitment, which has items such as not taking shortcuts due to the workload or prioritizing food safety over getting food out; employee commitment, which has items such as employees take responsibility for food safety and they follow food safety rules. And then finally, resources. Do they have the materials to do the job? And I will say for our resources, we focus the questions there around hand washing in the hand washing resources such as soap, paper towels. Is the sink accessible? Because that's something that all restaurants were going to have. So we wanted to have something that would be applicable to all restaurants. And when we did the analysis, we did that structural equation modeling, we really found these four primary constructs help to explain a higher order construct that we call worker beliefs about food safety culture. And for more information on the study, you can scan the QR code that we have showing on the screen here. So we also worked with our communications folks to develop some tools based off this manuscript that restaurants can use really to assess workers' perception of food safety culture in their restaurant. This assessment will give you a relative idea of where a restaurant is at and maybe in which of the four areas you may want to work to improve. You could use it, say, if you had a policy change and to see if the workers reported a change, or if your workers are still reporting a relatively consistent score over time. Did it affect how the workers are perceiving the food safety culture there? So I'd recommend, this if you're implementing the survey, really to keep it anonymous, perhaps have someone other than the owner or management do the tallying, just to kind of help with that forthrightness and responses. And unfortunately, though, we only have the assessment tool to see how the restaurant scores, but we do not have resources to improve these areas. However, the Conference for Food Protection has a food safety culture at retail committee that is working in some of these spaces. So I want to make sure I'm giving a shout out to those groups as well. So based on some of the preliminary findings from our ESNet study, where we're identifying what our primary constructs were, our partners in the Southern Nevada Health District conducted focus groups with both food workers and managers really to understand what were facilitators and barriers to improving food safety culture. And Lauren Dupreet with Southern Nevada really has summarized some of their key findings on this slide. And I really want to share because it really does feed back into what we're seeing. But things such as staff need more equipment, space, and supplies. Staff are really reluctant to share with managers. People say they have open doors, but the door may be open, but getting people to come through the door can be a bit of a challenge, which brings us to the next point there. Really, soft skills and relationship building are important for a good food safety culture. Having those relationships there. And not surprisingly, since this was conducted during the earlier stages of COVID, that the constraints, around COVID are really hitting restaurants hard and affecting food safety culture as well. And, the results here really do align with many of those constructs that we identified, such as, having leadership and resources there, as well as a little bit of the employee commitment and management commitment. So we're seeing that, what we saw from the focus groups is really kind of reinforcing what we had seen from the worker surveys in multiple sites. So we've identified our constructs, but our next question is, but what influences them? Are there factors within the restaurant that may strengthen them? If we know this, we may have an idea of where to target interventions to strengthen the restaurant's food safety culture. So to answer this, our next step was to examine how these constructs are associated with worker characteristics, restaurant policies, and restaurant characteristics. And we have the link to the article here with the QR code as well. So one concern when you do this kind of analysis, in employees working in the same restaurant may be more similar to one another than to other food workers in other restaurants. After all, they are being exposed to the same food safety management system. So we did do a statistical test and found that this assumption to be true, which is really good news for the restaurant operators. You are creating a culture, which is there. For our analysis, though, we accounted for the similarity statistically, and we used a continuous hierarchical modeling approach where we have food workers nested within a restaurant. So we found three worker characteristics. Make sure here. They were linked with more than one component of food safety culture, whether they've received food safety training at this restaurant, their level of food safety knowledge, and their educational level. And we found two restaurant characteristics were also linked with more than one component of food safety culture: the number of methods used for monitoring food safety practices and the number of written policies. Now, this may look a little bit similar to you is what did we look for as food safety management systems? We found the characteristics influence food safety culture are shared. So food safety management systems are normally comprised of three things: having food safety policies, training your employees on those policies, and then monitoring that the policies are being followed. So for this study, we found the number of written policies was associated with increased scores of leadership and resources. We found that having knowledgeable food workers, receiving food safety training at the restaurant, and the number of methods used for training employees was associated with all five constructs of food safety culture. And finally, we found that monitoring the food safety practices was associated with both management commitment and our higher order factor about worker beliefs about food safety culture. So you're probably going, Adam, this is all great, but the really big question, does it matter? Does this improve food safety performance and the food safety that's in the restaurant? So I mentioned at the beginning that we also did a brief observation in the kitchen. We gathered information on whether employees washed their hands when they needed to, if food was cold held at the proper temperature, and if they had bare hand contact with ready to eat foods. For all of these, we just recorded if they were in compliance or not, similar to what you'd be doing on a routine inspection. So to look at this relationship, we did, logistical regression with the constructs of food safety culture, predicting whether each of the practices would be in compliance. Ideally, we were anticipating that a stronger food safety culture would be associated with improved compliance. Unfortunately, the results did not bear out this hypothesis and were not statistically significant, which this gave me a lot of pause. Like, does food safety culture even really matter? Which, you know, may gives you a little bit of cause there. So we thought back to the restaurant and worker characteristics that were associated with food safety culture, and we amended our model. We inserted food safety management systems into the path and found with this a strong fit with statistically significant relationships. We found that a strong food safety culture leads to better implementation of the food safety management system, which in turn leads to better food safety practices. In other words, a strong food safety culture alone does not lead to better food safety performance. It has to be directed, such as by a food safety management system to lead to better practices. So what can we do? For regulators, put on that consultant hat. Don't stop at problem identification and marking a violation. Can you help the operator identify the problem? It may be one of two scenarios. The operator doesn't recognize it's a problem, or they recognize it, but they don't know how to fix it. Ask questions to help them probe into those underlying reasons. Why is this occurring? I've linked here to a resource document the CDC has or we'd put together with our NEARS users to really help identify the root causes of outbreaks. I know it's for outbreaks, not for routine inspections, but I would challenge you to not just limit the skill set to outbreaks. After all, we could consider a priority violation as a near miss without anyone getting sick. And we've been working along with this, some of our EHS-Net partners and FDA to pilot expanding this type of methodology to hand washing violations. And we're seeing it does work. We can dig in and understand what are those root causes to having what those hand washing violations are. And when you think about the violation, you dig deeper, it helps to show those underlying problems that are resulting in the violation. I think we've all been there before where you've mentioned, hey, you know, everyone writes it off as a one-off, hey, Joe didn't wash his hands. Well, you know, okay, that's a one-off. But when you start looking and you're like, hey, 20% of your inspections have someone not washing your hands, maybe there's something a little more systematic. Or trying to figure out, well, why didn't Joe wash his hands? Digging into asking those questions to dig a little deeper helps you understand the root cause and what can we do to solve this in the long term, not just the short term. So for our industry partners, didn't want to leave you out of this, is you are really where the rubber meets the road. And I'd ask you, challenge you to ask yourselves, do you have policies to cover your culinary practices? Are they written? Do staff know about them and access them as a resource, or are they locked in an office? How do you train your employees? Is it on the job with one teammate teaching another? Are they teaching the process the way that you want it to be done? Or have shortcuts slowly been introduced into that training regimen? Are you monitoring to ensure the practices are being followed? If not, how are you getting things back on track? So I think there's a little bit of opportunities for all of us in this space. So some key takeaways here from our research, we've really seen that a strong food safety culture is the foundation to implementing the food safety management system and improving food safety practices. So developing a strong food safety culture is not easy, and it requires continuous improvement. As new staff come on board, or in this case, as we've had pandemics happen, worker perceptions of the restaurant's food safety culture can change. And we really need to try to maintain that culture. It's going to take effort to get staff up to speed and keep them there. I also want to acknowledge that we have some other people working in the space. I mentioned earlier the Conference for Food Protection. They have both a food safety management system and a food safety culture at retail committees. They are both diligently working on materials to help assist both the regulatory and the restaurant industry with strengthening both of these areas. And with that, I'd like to thank you for the opportunity to speak to you all today. And if there are some questions, I would be happy to try and answer them or steer you completely astray.
Wonderful. Thanks, Adam. And remember, put your questions in the Q&A box. We do have one queued up ready for us from Alicia. How was it decided to choose hand washing, cold holding, and bare hand contact under the food safety practices? How were those chosen?
Yeah. So we started, when we were thinking about this, we're recruiting all restaurants. So we started to think, what are things that are common in every restaurant that we can look at? And everyone, I guess there may be a few exceptions that may not have hand washing if everything's all prepackaged. But when we're looking at the restaurants, we knew, well, we anticipated there would be hand washing going on with that, you know, that kind of led us into the bare hand contact. A lot of our work, as you see our things, has been focusing a lot on norovirus prevention and how can we do that. So that kind of led us definitely think about the bare hand contact portion. And then cold holding, it is something you're going to see in virtually all restaurants. So we tried to think about outcome variables that would be present no matter where we went in to go and look at them.
Yeah, great. Keep those questions coming while waiting for more questions to come in. I have a question. I was kind of curious when you looked at the employee sort of beliefs.
Mhm.
Was there strong agreement kind of within restaurants, and where there and was stronger agreement more, I don't know, linked to some of this positive food safety culture, or negative? I guess everybody agrees it's negative. Or did you see a lot of variability? I was just kind of curious.
Within a restaurant, the score, it so most of them only had 1 to 2 responses within a restaurant.
Okay.
So,
Oh, I see. Okay.
the
Okay.
two, if we had the two people, they were fairly close. The 15 one, it was, there was a range, but it wasn't a drastic range. So this is basically on a scale from like 1 to 5. You know, they may be within a standard deviation of maybe 1 score point. So which I know doesn't mean a whole lot to anyone except for people like me. But I mean, they were fairly grouped. It wasn't a super widespread. And I have to thank Stephen for noting the cute baby. This is my youngest grandson. So uh, we started explaining stuff, and that's the look I get back from him. So
Love it. Yeah, that is a great, great picture. It appears we have a raised hand. Amy, are you able to take Susan off mute?
Yes, Susan, I am going to allow you to talk. You should be able to unmute yourself and ask your question. Oh, your hand went down, so
Okay. So maybe that was an errant raised hand. That happens. No worries, Susan. We do have a question from Jack Gazech. How did managers react to the study?
When we started recruiting people, we were thinking that there was going to be a lot of hesitancy. We actually did get a lot of buy-in from a lot of the managers. A lot of the managers wanted to know, well, how did we do? Was our score? And, we were kind of stuck in a little bit of a difficult situation because we don't want to identify, hey, your employee Jim thinks you're great, or maybe your employee Jim doesn't think you're great. So, we didn't want to necessarily do that because a lot of the restaurants, they knew who their employee was who had taken it. So we did not want to, identify who that employee was. But I think, we talked with them a little bit about what are those issues and what are the things that were there and what were the findings that we were seeing. And we have been getting back with them about the general results of the study. We're making that all available to them.
Great. And yeah, keep the questions coming. We've got a couple more. So Stephen Everett asks, in your research, do you find there are certain ethnic groups that have more difficulty getting on board with the hand washing concept?
So, we really haven't tried to capture information on ethnicity of the employees or even of the restaurants. Um, but I will say, putting myself back from when I was doing inspections many years ago, as I realized that, yeah, I've got more fingers and more years than fingers and toes to count. Um, Hand washing's a challenge. And, conceptually it's simple, but, you know, making sure that people understand when and how to do it, it's always a challenge. And, when I was inspector, we worked with multiple ethnic groups that were there. From my experience, we didn't have one that stood out more than another, but it was more, is it a priority or not? And, if I've got time for a quick anecdote, we had I got in a sewage complaint at a hospital. Okay. So go there. They had sealed everything off. They'd snaked the drains. They were doing everything that they're looking at. We're still looking. And I'm going with the manager. We see an employee with his gloves on working on the tray line, which is where they're making all the food to go up to the rooms. Okay. See that guy with his gloves? He goes off into a room. I ask the manager, well, what's that room? Oh, that's a bathroom. Okay, we need to take a look there. You got an opening to the sewer, make sure nothing came up there. And we see that same employee come out of the bathroom, still has his gloves on, and going back to work on the tray line. We're asking him, well, what are you doing? And he's like, well, I'm doing that. We're like, well, you were just in the bathroom. He's like, yeah. We're like, but you still have your gloves on. You didn't go to the hand sink, which was behind me. He's like, but, and in his mind, he was wearing those gloves to protect him from all of us, not all of us from him. So it's an easy concept, but getting it through to people and understanding why they're doing it and developing those systems is part of that food safety management system where it's an expectation is a challenge. And another example is, my son has worked in the restaurant industry and, he was telling me his coworkers are asking him, well, why are you washing your hands all the time? And I told him the response should be, well, why aren't you washing your hands all the time? Um, so I think there is a knowledge gap and I think it's the training and we need to think about that monitoring. And it really gets to those food safety management systems. You have the policies about hand washing, when and how to do it. Do you train your employees to do it? and are you monitoring to make sure they actually are doing it?
Yeah, that's great. And
So
I
there's my
love that.
soapbox on hand washing.
That was great. And I love that you folded in the why there. That was a really good anecdote because for that one example, he's like, oh, I'm wearing these to protect myself. So
Yeah.
that was good. We have a couple more questions for you. First from Twee Kim, would you consider linking the survey results of each restaurant to their inspection scores to see how perceived culture within the restaurant influences scores? And she adds, I love scores.
I do. Um, that would be very interesting to look at. Um, the way we do our research, though, it's anonymous. So the
Hmm.
data collectors who are going out to the restaurants know what restaurant they went to. By the time the data gets reported back to CDC, it's just restaurant, California 2, or, 1 through whatever number we're doing, and then whichever site. So I can tell you which state it's in, but I have no idea what restaurant it is.
Got it. Yeah, thanks for that. Another question, is there a relationship between the amount of training, food safety training that people receive and their performance scores? Do you know anything about that?
So I can tell you probably indirectly, yes. Um, because what we're seeing is, if they receive food safety training at the restaurant itself. So when we saw, have they ever received food safety training, really wasn't coming up as a strong predictor. But if they had received food safety training at their current restaurant, that was, we were finding, as a strong association with um, a lot of the food safety culture constructs. And having that strong culture, having those policies, all are leading to it. So indirectly, I would say having that training in the restaurant is what was leading to it. You know, and when we say any training, you start thinking about back in, well, what training were they receiving? Was it good training? Was it bad training? Um, so at least within the restaurant, it's there and hopefully reinforcing that restaurant's policies and their food safety management system.
Got it. Thank you. And we have a couple questions actually about employee health policies. One specific, one more broad. So first, from Jack, do you assess exclusion of workers who were ill with an intestinal disease? And then, so that's assessing exclusion of folks who are ill. And then Adam Inman asks, what's your take on assessing employee health policies?
So this is our next study.
Oh, all
It was
right.
our sick food worker study, which, we did look at those things. Um, I don't have all of those results right in front of me, so I am going to probably stroke go with the big strokes there. Um, with, in that sick food worker policy, we really were trying, or sick food worker study, we did as an educational intervention, and we tried to understand what was the restaurant's initial policy for employee health. When were they excluding or restricting? Now, I will say, having both of those there, it gets a little confusing. A lot of restaurant operators were not really familiar with the whole restriction concept, and I think that probably muddied the waters a little bit as we were doing it. But there we did ask about their policies, and for that study, we were doing an intervention study to see if it would doing an educational intervention would get restaurants to improve their policies. And we came back about 3 to 6 months later to kind of look at what those results were. Now, I will say in that one, the majority of restaurants probably wasn't the biggest amount of change. We did see some restaurants, yes, for a couple of our outcome variables, we did see, for those that were changing, we did see a much bigger positive change in the restaurants that received the intervention. But we had control and intervention restaurants, and probably for both of them, the biggest group was no change, which I don't think is a big shock to anyone here. There's a lot going on, and I think we need to think a little more comprehensively about what we do to try to motivate or incentivize change. And I will maybe put in a plug for the FDA retail food seminar, where Beth Wittry and I were going to be talking about this specific issue.
Excellent. Great. Thank you. Just going to pause to see if there are any other questions. Getting lots of kudos for the presentation in the chat. So, all right. Well, with
Thank
that,
you. Yeah. Sorry, I went a little quick.
no, it was good. It was
Good.
it was great information. And I guess maybe with one kind of last question about the kind of the key takeaways. Do you have some unanswered questions about food safety culture that you would like to do future studies on, or would like others to consider maybe doing future studies on? So it's always, uh, each study you do leads to more questions. So I'm just
Yeah,
curious if you've got additional questions you'd like answered.
of course I do. I'm in the research. I always have more questions. Each
Yeah.
question generates about 3 more questions. I think it'd be nice to help flush out some of these constructs a little more, coming up with a little bit more, having some additional questions to build some stronger pieces there. And ideally, to start thinking about this as an ongoing measure for restaurants and understanding how does how our workers are perceiving this, maybe integrating this into illness investigations or complaints inspections, or hopefully understanding what's there. And really, is some of the previous researchers have identified this is an emerging risk factor for food safety performance and for foodborne illness. So recognizing what's going there, and you know doing what we can to help ingrain these different pieces, and realizing that the culture, it's not a you have it or you don't. It's going to be a continuum, and it's going to keep moving back and forth on that continuum. Is There's changes in the restaurant, so trying to do what we can to keep strengthening and building it is those are the pieces I'm looking forward to, and I'm looking to see what the Conference for Food Protection committees are coming up with is those resources for people to use.
Wonderful. Well, thanks, Adam, and thanks to all of you for participating today's webinar and all of your insightful questions. Please be on the lookout for a post-webinar email with resources from today's session. And also, I'm going to put in the chat, we've got one last Fresh Take Friday presentation. That's next Friday, December 12th, when Melanie Benish will be speaking on food additive regulation. All right, well, thanks everyone, and we will see you next time.